It's Zazie Siosi, physical therapist, here with your Movement Minute for today. So today we're going to talk a little bit about the pelvic floor and just have you learn a little bit of information about your own body. So this is kind of like body school, pelvic floor 101. So I've got two models here of a pelvis so that you can just kind of start to get a little bit more knowledge and background about the differences between a male pelvis and a female pelvis. And so in my prior video, I talked about how pelvic floor disorders are not just exclusively for women and that they also affect men. So there are differences between men and women in the sense of what the disorders can be, how they can show up, but even within each sex, there are differences between each person. So some anatomical differences, just to start off with, is that this is Steve. He's a male skeleton, or a male model of a skeleton. And so when we look at his pelvis, it's very heart-shaped. And the pelvic inlet, or the opening here, is pretty small. So within, males and females, we have our bladder that sits kind of right on top of this pubic bone. And we've got the rectum that comes right along the back of what we call the sacrum, or the bone that kind of creates the back part of the pelvis, and also attaches and ends in the tailbone or the coccyx. In females, when you look at a female pelvis, if I just put them right next to each other, you'll see that there are some differences that kind of pop out right away. So if you look at the pelvic openings, you can see that the female pelvis is wider in diameter, which makes a little bit of sense because our bodies basically can have babies. So another thing you can kind of tell is that the female pelvis is a little bit larger. And again, that makes sense because we are basically made anatomically to be able to have a baby vaginally. And so our baby has to be able to come through the pelvis, whereas in a male, anatomically, they're not made for that. So their pelvises look a little bit different in consideration for the functions that they have to go through. So in a female, we also have the vagina, which is the tube on the inside in between the bladder and the rectum. We also have on the outside what's called the vulva. So that is an area that can be painful for some people. Okay. So now going to the pelvic floor itself. So you actually have, and I have a little model here that you can kind of see, everything in white is a bone, and it kind of gives us a couple of different layers for what the actual pelvic floor muscles are. And so you'll hear a lot of people talk about their pelvic floor as if it's just kind of like one muscle. And actually, it's a lot of different muscles. And you actually have 3 layers of pelvic floor muscles. The first layer is on the outside, and it's more superficial. And in this model here, you can kind of see you have a muscle that goes from one sit bone to the other, so across, right above basically the anal opening and below the vaginal opening in women. In men, it's just above the anal opening because you don't have a vaginal opening, right? And so then you have another muscle that basically goes around the pubic bone. So again, looking at this model, you've got it kind of basically lines the pubic bone here. And then that other muscle comes from one pubic bone to the other. And then you have another muscle. For women, it goes around the vaginal opening, and for men, it actually goes up the shaft of the penis. And so that's the first layer. The second layer of muscles actually wrap around the urethra, where we pee from, to help constrict the urethra so that we're not peeing on ourselves all the time. And the third layer is what we call collectively, again, another group of muscles, but we call them collectively as the levator ani. And so that is your deepest layer of pelvic floor muscles, and they really help with kind of stabilizing through the pelvis, and they're really a function of your core, and they really work well with your abdominal muscles in the front. And so a lot of times what I'll say is like, the pelvic floor and your abs are like, girls that go to the bathroom. They always go together, so they're BFFs, and they really are supposed to work in coordination with one another. And so sometimes what I'll see is that for whatever reason we have a pelvic floor issue going on, the connection between the abdominals and the pelvic floor basically just kind of gets disconnected. And a lot of times what I'll see even further as far as disconnection goes is your brain's ability to control and to be able to have your muscles do whatever you want them to do voluntarily, especially after there's been any pain in the pelvis, any injury in the pelvis, pregnancy, birth, postpartum, menopause, premenopause. Lots of different things can basically have your brain kind of disconnect from a specific area, in the sense of now you don't really have as good of control or any awareness of like what's going on down there. And so that's really important to have, just like anywhere else in the body. If you lose connection to your arm, well, now you can't lift things up, now you can't raise your hand, now you can't do all of the normal functional things that you should be able to do with this body part. So what makes the pelvic floor a little bit different is that it's not only muscular action that it is basically influencing, it's also influencing your urinary function, your bowel movement function, your sexual function, your core stability, and even how well you can move blood through your lower extremities and back up to the heart, so that lymphatic flow. So it's one of those things that if you've got a problem there, it's a really big quality of life issue that a lot of people don't really talk about because it's embarrassing. And two, they don't even know who to talk to about it. A lot of times, primary care providers are not the greatest resources for pelvic health information because it's not their specialty. And so a lot of people have basically resigned themselves to just kind of living with having to wear a pad for urinary leakage or living with pelvic pain. And that's really something that can be addressed conservatively, and can be addressed in a way where we basically empower you to be able to fix yourself, and you're the hero of your own story. Nobody else has to come save you. We're just here to help guide you along your journey. So if this is something you have issues with and you kind of weren't aware that this is something that can be fixed and can be improved, then you're in luck. I am a specialist in orthopedics, but also a specialist in pelvic health. So if you have any questions and just want to learn more about what's going on with your own body, just let me know. All right, that was your Movement Minute for today. Catch you next time.